Vitamin D is one of the important fat soluble vitamin, and very often deficiency of vitamin D is found nowadays more commonly among the urban adults than the rural pediatric population. Okay. So the urban adults, they show deficiency of vitamin D more common. As we know, vitamin D are available in two forms. One is D2, other is D3. D2 is a form called ergosterol, which is found in plants, and D3 is found in animals. Can animals store vitamin D? Yes, animals can store vitamin D. Where? Mostly in liver. What are the organs involved in synthesis of vitamin D in our body? Three organs: skin, liver and kidney. Skin, liver and kidneys. Sources: mostly milk and milk products give a good source of calcium. Otherwise, it is found in almost all outer shells, just hard shells of shellfish. If you take the shell, you can crush and eat, you can get calcium source. Then calcium hydroxide as a good source. Yet, these calciums are very little absorbed from our diet. We need calcium in a more soluble form, which is available mostly in the emulsified milk products. The better source is the organ meat. If we consume the liver, kidneys and other organ meats, then we can get good amount of vitamin D. The biosynthesis of vitamin D begins in our skin, where cholesterol is converted to 7-dehydrocholesterol by the effect of sunlight. Okay. Then, exposure of sunlight, 7-dehydrocholesterol converts to pre-vitamin or pre-calciferol, which takes an isomerization followed by this, and it forms cholecalciferol. So, 7-dehydrocholesterol is an intermediate of cholesterol biosynthetic pathway, which give rise to formation of or opening of the ring structure. What is the name of the ring present in cholesterol? Cyclopentanoparhydrophenanthine ring. That ring gets opened at the level of skin in the form of 7-dehydrocholesterol. It opens to form cholecalciferol. So, cholecalciferol is an open form, right? Now, these cholecalciferol, see, it takes 2 to 3 days, this process. It's a slow process. It takes 2 to 3 days, slow process. The last part, the next part occurs in the liver. What is the enzyme? 25-hydroxylase. Enzyme 25-hydroxylase. Next, it is transferred to where? Kidneys. In the kidney, there is a specialized enzyme called 1-alpha-hydroxylase. So, the third hydroxylation step takes place in kidney. Fine. Now, after this process takes place. Just see the process now. We will come to that later, why it is important. What is the process? 24 hydroxylation. It is a 24 hydroxylation. It is a minor step which converts D3 to 24 hydroxyl containing product, which is a minor product, which has got vitamin D like structure, but its function is still unknown. Its function is still unknown. This one takes place in kidney as well. So amount of 24 hydroxylase might give you a kidney function test, whether it can synthesize this one more or better or not, vitamin D, right? So we get 3 hydroxyl group, hence the name called calcitriol. What are the 3 hydroxyl groups present in vitamin D? 1 and 25 is mentioned here. What is the third one? What is a starting material for cholesterol biosynthesis? For cholesterol. What is the position of hydroxyl group in cholesterol? So 1, 3 and 25. 3 is already present. Only we have to add 1 and 25. So 25 will be added first, followed by 1. Together, it is called calcitriol. In ergosterol, one extra double bond exists, which is not required us to know. Now, as we know, the sunlight is required for the synthesis of vitamin D from skin. So there are some factors which affect this biosynthesis. Vitamin D is also called sunshine vitamin, means it is synthesized under the sunlight. What are the factors that affect the vitamin D synthesis from sunlight or in our body? Number 1, species. Species means Donald Trump and Narendra Modi, both are human beings. Are they same? Right. Their skin color, their texture, their metabolism, slightly different. Just like Brad Pitt or Priyanka Chopra and Nick Jonas. Nick Jonas. So one is white, we are brown, someone is black, someone is yellow. So these species difference vary vitamin D synthesis. The darker the skin, more potent to produce vitamin D. Lighter the skin, less. That means where sunlight is plenty, there people will be darker or whiter. Darker. But it is not always true. So for example, in Middle East, everyone is white, at least whiter than us, but it receives most of the sunlight. Then what is the difference? Why they are not so black like we are? Species difference. They are slightly different in ethnic group. Right? Moreover, the darkness of the color depends on the moisture present in the atmosphere. If you are sweating, you will develop black color skin more, prone to develop black color skin more. Melanocytes will be more. If you are in dry region, arid region, then you may not be that black. Just imagine the areas of our body which sweat more, they are usually dark in color. Similarly, thickness of the skin and amount of pigmentation. What do you think? At the age of 8, at the age of 18 and at the age of 88, when you are having the thickest possible skin. Huh? 18, because that then whatever your parents will say you can ignore, right? Because you have very strong, right? Huh? At the age 88, you have thinnest skin. That hypodermal fat is mostly depleted by the older age, correct? The younger you are, you have thicker skin. So thickness of the skin directly affects the penetration power of the sunlight. So which one is better? At the 88 you will produce more vitamin D with the same skin, or at the age of 8? Huh? At the age of 88. But remember, I mentioned at the age of 88, your hypodermal fat is depleted, which is a source for 70 cholesterol. Now you have thinner skin, but you don't have hypodermal fat to store 70 cholesterol. You have factors, but not the substrate. So you produce less. Correct? Pigment. If you are highly pigmented, will you produce more? If you are less pigmented, will you produce more vitamin D? কি মনে হয়? What is the function of pigment, melanin pigment? They protect your skin from sunlight or they do not? They protect, they disallow the penetration of sunlight. So more pigmented you are, you require more time of exposure to sunlight compared to the one who is whiter than you. Correct? Time of the day and season. Which time of the day is good or best to produce vitamin D? Morning, mid-noon, afternoon? Morning, why not dusk? Morning and afternoon, both are fine. Same light will come. Right? Why not at 12 o'clock? Because at 12 o'clock, the light which is required in UV range, which is required for synthesis of vitamin D, is present. But along with that, the unwanted UV rays are also present. So exposure to sunlight might be less, but it will be more harmful. It will be more harmful. So it's better to get your skin exposed during the morning and the afternoon time, when sunlight is little subdued. Clear? Season, winter season or summer season? Which one require more time of exposure? Winter season require more time of exposure. The 10 minutes of exposure in summer time is sufficient. To get that amount of vitamin D synthesized in your body, you might require 30 minutes of sun exposure during the winter season. London and Kolkata, what is difference? Apart from TMC, latitude, what makes them different? Both are rainy season, both are rainfall, high rainfall area, both Calcutta and London. So rain is not a matter. What is matter? Only the latitude. Latitude means how tangentially the sunlight falls on these cities. So in the morning, if you are exposed to sunlight around 8 to 8:30 is sufficient. But to get same amount of exposure, same amount of vitamin D synthesized in London, you may have to expose for 2 hours. Right? Because the sunlight is much milder compared to Kolkata. Fine? Next, When I say exposure, how much of your body should be exposed? What he is wearing, is it sufficient exposure to get vitamin D? What do you think? See his outfit. Is it okay? Or he needs to be wearing the vests, gym vest. Which one? Is it okay? It's okay. It's fine as long as he is in Kolkata. Suppose he is in Antarctica, then it is not sufficient. Right? So this much exposure is sufficient. This much exposure is sufficient. The most important region for exposure of sunlight is back of the neck. If you are having long hairs, you are losing something. Correct? That means he needs more time of exposure in sunlight. And if you are like me, then less. Right? Age. Already explained. Your grandpa and you, who will receive more amount of vitamin D from sunlight, same amount of sunlight exposure. You definitely. Why? Because your grandpa has lost his hypodermal fat because he is very old, his skin has become wrinkled. Although his skin is very thin, but hypodermal fat is less. Use of, what is this? Sunscreen. This particular zone will respond. How many of you use sunscreen? Only one. Such a big lie. Yes. You don't use sunscreen? Don't use. Then why? Whether you are dark or fair, it has nothing to do with the use of sunscreens. First of all, it is not cream. It is cream. It is not cream. It is screen. The ointment we apply is called sunscreen, either lotion or ointment, not like cold cream. Okay, fine. Number. Now, if I ask you, you use, right? Sir. Tell me, when you are going to buy a sunscreen, what things you look for, apart from the heroine or the actress who is giving the ad? Huh? SPF, sun protection factor. How much would you buy? 40 or 50? You? Why? Anyone said? Dermatologist said. How many of you have taken prescription from dermatologist before buying sunscreen? You have taken? How much he or she advised? If you have 60. Why? Do you have any problem with skin? Sun allergy? Do you have any problem with sun allergy? Then we should more higher the number, actually it causes more harm to the normal skin. If you are not exposed to sunlight like a farmer or like a laborer who is working on the for the construction of road, you do not require sunscreen. A study was conducted among the Japanese population where everyone was given sunlight, to a given population, sunscreen. After the application of 10 to 15 years continuously, they were found all deficient in vitamin D. So it is not required. If you are going for a bowling for a whole day test match or one day match, you might require sunscreen. Not for the protection of the skin, but for looking better in the next day in the ad film. Mahindra Amarnath, Sunil Gavaskar, Kapil Dev, they did their ad film with normal skin, but not the same thing applicable for Virat Kohli, Rohit Sharma, Hardik Pandya. Why he needs to be applied? Why he needs to apply when God has given so much to Hardik Pandya? Pigmentation doesn't require. You know? What happens when you apply sunscreen? It deflects the sunlight UV rays which is required for vitamin D synthesis. How much SPF factor you can use? As less as possible, depending on your time of exposure to sunlight. 5, 10, 15 maximum. If you have some skin allergy, then you go for like this. Specialized. What else you might apply with that? The presence of sunscreen not only blocks the sunlight to come in, but also blocks the expiration, the sweat glands. So your skin becomes heated. It cannot get naturally cool down. Right? ঘাম হয় না বলে স্কিনটা গরম হয় এবং স্কিনটা তখন রাফ হয়। To prevent that, we must apply moisturizer along with the sunscreen. Always. So choose wisely and after taking the advice from a dermatologist if required. If not required, don't apply. Nothing will happen. Nothing will happen. Absorption. It requires fat for absorption. Passive diffusion and dependent on the presence of bile salts. So any condition which blocks bile salt will lead to malabsorption of vitamin D, like the condition of obstructive jaundice. Right? So in obstructive jaundice there will be decreased vitamin D absorption. Which region? Now, why do you need these regions to remember? Whenever I am teaching some vitamin or mineral, I mention some regions of the intestine where it is absorbed. Can anyone tell me why do we need to know this portion, this particular line in every vitamin? Because in this supplementary examination, one question came. If there is duodenectomy along with part of jejunum, then which of the following factors will not be absorbed? Right? That is why we require to know which portion they absorb. When we are removing a part of the intestine, then we must remember which part we have removed and accordingly we must give the supplementation. Because the person will not be able to absorb from diet. We have to give them non-dietary supplementation. What is that? Injection, right? Now, DBP. From skin, it is carried to the liver by vitamin D binding protein. Lumisterol, tachysterol and other side products are sloughed off during turnover of skin. Normal skin layer gets sloughed off every now and then. Along with them, it is removed. Two sets of hydroxylation reaction, one in liver, another in kidney. Already I have explained, one is liver 25 hydroxylase and in kidney 1 alpha hydroxylase. Which one is more important? This step. Without this, ultimately calcitriol will not be synthesized. Right? So if your kidney is damaged, it is more likely that you get vitamin D deficiency. Even though you are from a very good, well-to-do family, you are getting good food, doesn't matter. You have to be given pure vitamin D supplementation. Dietary supplement can be given. Now, effect of vitamin D or function of vitamin D. What is the major function of vitamin D? Number one, it helps in calcium metabolism. How? It mostly helps in calcium absorption. First comes absorption, then comes utilization of calcium. So first, in the absorption process, it helps. How it helps? How vitamin D helps in calcium absorption from gut. Vitamin D, being a fat-soluble vitamin, does not require a cell surface receptor, which is partly untrue. Some study has shown that there is a specific receptor for vitamin D as well on the surface. For the time being, you remember, being a fat-soluble vitamin, it does not require cell surface receptor like other hormones like glucagon, insulin, etc. Right? So, this particular function of vitamin D makes it more like hormone. They directly enter the cell, where inside the cell vitamin D binds with a receptor, intracellular receptor called VDR, vitamin D receptor, VDR. Then these VDR and calcitriol together, they bind to a portion of DNA which is specific for this VDR calcitriol binding. VDR calcitriol binding region. Okay? Hormone receptor binding region. There, when they bind, certain proteins are synthesized. For example, in this case, calbindin, a protein called calbindin is synthesized. How? A particular mRNA is synthesized from mRNA, it is translated to calbindin. This calbindin protein then binds with free calcium, which is being absorbed by specific transporter from the gut. The free calcium is quite harmful for the cell. It's very highly reactive. It triggers some other reactions also. So, as immediately as possible, the calbindin must bind the free calcium inside the mucosal cell. When they bind, the calcium is now chelated by the calbindin and it holds the store as long as possible is required for the body. So, these calbindin will then transport the calcium to the blood as and when required. And again, it will come and bind with the free calcium. This cycle will go on. But provided in absence of vitamin D, the normal calbindin protein, due to its normal turnover rate, will go off after some time. So, calcium absorption will be decreased. So, vitamin D supplementation is required for regular absorption of calcium. Clear? It's not like once in a while you take vitamin D and that's all. No. If you are deficient, then you may have to take periodically vitamin D supplementation. Fine. So, this is a process. This is an answer for two questions. One, vitamin D acts as a hormone. Two, function, vitamin D helps in calcium absorption. This question number 2. Question number 3, why I am discussing in like this way? Because nowadays they are asking this type of question, more of practical approach. The function of vitamin D, as far as mucosal cell is concerned or any other body cell is concerned, are divided in 2 parts. One is genonical, one is non-genonical function. This is genomical function. Genomical function means it works through the DNA. So, the absorption of calcium depends on genomical function of vitamin D. Correct? The non-genomical function has got some other role to play with MAP kinase pathway. You have any idea of MAP kinase pathway? Any idea? MAP kinase pathway? So, it's a pathway which converge with the pathway of insulin. Okay. Some pathway which might also converge with some cancer pathway also. So, it is a different issue. We will take it separately. But the genomical function means it will enter into the nucleus and bind with the DNA. Fine? That's all. Other metabolic function. Apart from intestinal absorption of calcium, intestinal phosphate absorption is independent absorption also, renal absorption of phosphate. I am skipping this because already this has been taught in calcium, right? Have you come across this diagram ever? This type of diagram during calcium absorption? Any idea what is this diagram about? It is a single diagram which is applicable for many questions. Calcium and phosphorus metabolism, vitamin D and calcium metabolism, PTH, calcitriol, calcitonin and their effect on calcium metabolism. Like this different question, one answer. This answer starts from here. That is homeostasis of serum calcium level. I just explained this diagram. This type of diagram is present in many of the books you study. You can choose any diagram from any book. It's not like that it is, you have to choose only this one. Okay. Just try to understand what I am telling. What all points you must remember when you are answering this particular question. What is the question? Homeostasis of serum calcium. How serum calcium level is maintained in a narrow range. The normal serum calcium level is between 9 and 11 milligram per deciliter. If it goes beyond 14, it is detrimental. If it goes below 7, it is dangerous. In both the cases, you suffer from cardiac arrest. Okay? Now here, if the blood level of calcium is low, then this low calcium level triggers PTH. PTH means parathyroid hormone or parathyroid gland. PTH secretion or parathyroid gland. Parathyroid gland, location of parathyroid gland you know. Behind the thyroid gland, how many pairs? 2 pairs. Okay? Achha. Superior and inferior pairs. There, it stimulates the PTH secretion. When PTH parathyroid hormone is secreted, parathyroid hormone has got 2 actions. Number 1, it increases serum calcium level and it decreases serum phosphate level. It allows reabsorption of calcium from renal tubule and it allows excretion of phosphate. So, hyperparathyroidism leads to hypophosphatemia. Hyperparathyroidism leads to hypercalcemia. Hypoparathyroidism leads to hyperphosphatemia. Hypoparathyroidism leads to hypocalcemia. Clear? So, it has got similar function that of the calcitriol. What does calcitriol do? Calcitriol also increases calcium absorption from gut and reabsorption from the renal tubule. Both are fine, but it has no function on phosphate metabolism. But it has, where? In particular tissue, in bone. In presence of calcitriol, the bone metabolism is stimulated. That means bone is synthesized. It's called mineralization of bone. The opposite to this is called demineralization or bone resorption. The PTH causes bone resorption. Now there are two types of cells, osteoblast and osteoclasts. Which cell is required for bone mineralization? Osteoblast. So vitamin D increases osteoblastic activity. Which one is required for the opposite? Resorption of bone, osteoclast. So PTH increases. So when our blood calcium is low, which hormone we need to synthesize? We need to synthesize calcitriol. But calcitriol we cannot alone synthesize. Why? Because the last enzyme or the rate limiting step of the calcitriol biosynthesis is 1-alpha hydroxylase, which occurs in the kidney and which comes in direct action of PTH. So we first stimulate parathyroid gland, then parathormone is secreted, then parathormone initially goes into three regions: kidney, bone and renal tubule. From renal tubule they reabsorb calcium, excrete phosphate. From where they excrete phosphate? Because in the bone they demineralize bone. They remove calcium phosphate from the bone and phosphate is separated. That phosphate is excreted and serum calcium level is increased. This is the immediate effect. The later effect is the PTH goes and stimulate 1-alpha hydroxylase in kidney. So production of 1-alpha hydroxylase increases. Hence calcitriol biosynthesis takes place. Hence vitamin D is absorbed from the gut. So two ways they help. One, calcium is absorbed from the gut in presence of vitamin D. Right? So one, they reduce the excretion of calcium through urine, they increase the absorption of calcium, and more immediately they take up calcium from the bone, so that calcium level does not fall below certain level. Clear? These all three functions has been explained here. Now, if the serum calcium level is high, that's opposite scenario. What will happen? Come on, anyone, tell me. Try. বলো, চেষ্টা করো। Anyone? বলবি? তুই জল খা। ঘুম পাচ্ছে তো। চেষ্টা করো। Stand up. What happens when your calcium level is high? When the serum calcium level is very high, how your body will react to control it? This is when low. When it is high, how will it control? The third hormone called calcitonin will come into action. Calcitonin is secreted from thyroid gland. So it will stimulate thyroid gland. The low calcium level in the serum will stimulate thyroid gland. Thyroid will secrete calcitonin. Calcitonin will excrete calcium through urine. So the excess of calcium will get excreted through urine and our body will get relief. Okay? So this is the effect of three hormones. What are those? Calcitriol, parathormone and calcitonin. On what? On serum, maintenance of serum calcium level, or otherwise called homeostasis of serum calcium. Very, very important question. Very, very important question. Correct? Now we come to a non-classical function of vitamin D. Quickly. In immune function and in diabetes. Just take a photograph. You don't need to remember much. Vitamin D deficiency. What is there? Two things. When young, you have rickets. When older, you have osteomalacia. Do you have osteoporosis? If you have less amount of vitamin D, what you will have? Osteoporosis or osteomalacia? Osteomalacia. To get osteoporosis, you need to be older, much older than your age. Right? Osteoporosis is different. It's a condition of multiple effect. But osteomalacia is due to vitamin D. When you replace vitamin D, it will be reverted back. That's all. Fine? Now, for rickets, what are things you must see? Symptoms? The spine becomes curved, pelvic and thoracic deformities occur, ricket rosary, the osteochondral joints of the rib looks like a garland, হাড়ের মতন মনে হয়, একটা বিডেড গার্ল্যান্ডের মতো মনে হয়, ঠিক আছে? আর লং বোনস অফ লেগ, ওয়েট বিয়ারিং বোনস, এগুলি বেঁকে যায়, it bends inwardly or outwardly. If it bends inwardly, we call the condition of knock knee. If it bends outwardly, we call the condition of bow leg. Osteomalacia, mostly it is characterized by fracture prone bones. Small fall, small hit will cause bone fracture. This is how it looks like when you take an X-ray. It shows the bending of load-bearing bones. What else? Now, next picture is there I show. This is a very famous picture. Very famous picture. Till final year, you will have this picture. Short case in pediatrics. Vitamin D deficiency. কি করে বুঝবে? X-ray নাও, palmar X-ray, এবং দেখবে bone density দেখো less. So, it goes soft bone, মানে less density of bone. It shows there is less calcification of the bone. What is the reason? Mostly vitamin D deficiency, if not otherwise, some critical cases. Right? Now, there are a few drugs which might lead to osteomalacia type of condition. Like some anticonvulsants might show, then oral contraceptive pills will show osteomalacia condition. Right? So there are certain drugs, not much required. At the moment, we'll see gastrectomy, intestinal malabsorption, liver disease, mostly due to alcoholic liver disease. Vitamin D toxicity. Toxicity occurs when we take 5 times the RDA, at least 5 times the RDA. What is RDA for vitamin D? একদম বলিনি তো, কেউ বলতে পারবে? 10, 20, 40, 10, 20, 40 milligrams per day. না কেন? সরি, মাইক্রোগ্রাম পার ডে। 10, 20, 40, 10, 20, 40। 10 হচ্ছে ফর নর্মাল অ্যাডাল্টস মেল, 20 ইয়াং বাচ্চাদের জন্য, children and 40 pregnant lady. ঠিক আচ্ছা, আরে কি হয় মোস্টলি দেখো এখানে অপোজিট টু ফ্র্যাকচার, হোয়াট ইজ দেয়ার? হাইপার ক্যালসিফিকেশন। হাইপার ক্যালসিফিকেশন মিনস স্টোন হবে। কোথায় স্টোন হবে? আদার টিস্যুতে। বোনে স্টোন থোড়াই হয়, স্টোন কোথায় হয়? কিডনি, লিভার, তাই না? এইসব জায়গায় হতে পারে। তো সেই কি লাংসে, হার্টে, হার্ট ভেসেলসের মধ্যে স্টোন হবে, ক্যালসিনোসিস, ক্যালসিয়াম প্রেসিপিটেট করবে, হার্ডেনিং অফ দি ব্লাড ভেসেলস হবে, কি বলা হয়? আর্টেরিওস্ক্লেরোসিস, তাই তো? anorexia, nausea, renal failure and death. If you consume too much of vitamin D, very much obsessed about vitamin D consumption, then you might see your deity very soon. তাই না? কি হাসছিস যে? ঠিক বললাম কিনা? আরাধ্য দেবতার দেখা পাবি। ভিটামিন ই, what is most required for us? If you are in urban area, urban lifestyle, vitamin E is your next mother. He will take care of everything, whatever harmful things you ingest. ভিটামিন ডি এই সোর্সগুলো খুব সহজ। এডিবল অয়েল, এগুলো জানা দরকার নেই। দুটো ফর্মে পাওয়া যায়, টোকোফেরল আর টোকোট্রাইএনল। টু ফর্মস আর অ্যাভেলেবল, টোকোফেরল অ্যান্ড টোকোট্রাইএনল। এই রিংটার নাম কি? এনিওয়ান? হোয়াট ইজ দ্য নেম অফ দিস রিং? লিখে রাখো, ক্রোমেন রিং। ক্রোমেন, CHROMANE, ক্রোমেন। It contains ক্রোমেন রিং। কি কি ফর্ম পাওয়া যায়? আলফা, বিটা, গামা, ডেল্টা। কোনটা ভিটামিন ই এর মধ্যে? Which one is actual vitamin A? Alpha, বাকিগুলো নয়। Only the alpha tocopherol has got vitamin E like activity. Alpha tocotrienol has got vitamin E like activity. Both tocopherol and tocotrienol same vitamin E like activity. এবারে ডায়াগ্রাম দেখো, what is the function of vitamin E? The major function and the only function of vitamin E is we care about antioxidant activity. It's a chain breaking, it's a chain breaking antioxidant. Chain breaking মানে antioxidant যখন প্রপাগেট করে তখন একটা চেইন প্রপাগেট করে, মানে একটা চেইন রিঅ্যাকশনকে। In presence of vitamin E, this chain reaction is stopped, তাই না? যাতে ফার্দার এই ফ্রি রেডিক্যাল গুলো আর প্রপাগেট করতে না পারে। কি করে করবে না, এদের মধ্যে এই যে ডাবল বন্ড রয়েছে, এই ডাবল বন্ডগুলো বা এই যে OH, এই ডাবল বন্ডগুলো রয়েছে, এই OH গুলো ওরা ওই ইলেকট্রন নিয়ে পারঅক্সাইড কম্পাউন্ড তৈরি করবে, ইপক্সাইড কম্পাউন্ড তৈরি করবে, ইপক্সাইড। আর যদি এখানে বাইন্ড করে তাহলে যদি সিঙ্গেল মলিকুল বাইন্ড করে অক্সিজেনের তাহলে ইপক্সাইড কম্পাউন্ড, যদি ডাবল মলিকুল বাইন্ড করে তাহলে পারঅক্সাইড কম্পাউন্ড। পারঅক্সাইড কম্পাউন্ড বাইন্ড করলে কি হবে? মলিকুলটা ভেঙে যাবে। দুটোই হয় কিন্তু, ঠিক আছে? এই যে মনে করো পুফা মানে কি? ফাইন। কোথায় পাওয়া যায়? বলিস না আমি সর্ষের তেলে পাওয়া যায়, সেল মেমব্রেনে পাওয়া যায়, আমাদের নর্মাল সেল মেমব্রেনে পাওয়া যায়, প্রত্যেক সেলের সেল মেমব্রেনে এটা পাওয়া যায়, ঠিক আছে? এবার মনে কর এই যে এগুলো কি তৈরি হলো? ফ্রি রেডিক্যাল। কি করে তৈরি হলো? তাই না? alcohol, tobacco abuse, all this will generate, right? Now these compound has got free radicals, মানে এগুলো কি? ডট গুলো ফ্রি ইলেকট্রন। Now these free electrons will attack the PUFA, and then it will form peroxides, and then it will break. It will break to form RO and ROH. মানে একটা অ্যালকোহল আর একটা কার্বক্সিলিক অ্যাসিডে ভেঙে যাবে। It will split in one alcohol and one carboxylic acid, ROH আর COH. এই ডট গুলো থাকা মানে হচ্ছে they are still in free radical form. H হয়নি এখনো, they are not yet attacked by the hydrogen. To remove these OH, we require vitamin E. Vitamin E, the double bond present in a bromine ring, will quench these free electrons. Clear? Free electrons will be taken by the vitamin E, and these will form ROH and ROH. This is harmless. This is harmful. This will trigger a chain reaction. To start a chain reaction, go on. But as soon as vitamin E takes up the dots, it becomes harmless organic molecules. Clear? That is why it is called chain-breaking antioxidant. যে কথাগুলো বলছি পরীক্ষার খাতায় এই কোশ্চেনগুলোই আসবে, এই জিনিসগুলোই লিখতে হবে, ভাই এইগুলোই জিজ্ঞেস করা হবে, এইটাই বলতে হবে। ভিটামিন ই, now it is joined with a free electron. This has to be regenerated. For regeneration of vitamin E, we have two important compounds, vitamin C and glutathione. These two compounds will regenerate free vitamin E again. So presence of vitamin C will reduce the requirement of vitamin E and vice versa. Presence of glutathione, reduced glutathione, will reduce the requirement of vitamin E. This kind of effect is called sparing effect. So question may come for the same diagram, explain the sparing effect of vitamin C over vitamin E. একই উত্তর, অনেকগুলো কোশ্চেন, তাই না?